Thank you for joining the Doctor Whisperer. I am your host, Sharon Feckety, and I am happy to bring you a show where we talk about the business of medicine. I hope that you enjoy it. Please feel free to share, subscribe, and pass it on. Enjoy the show. Well, I'm very happy today for you all to learn about this company that I have just recently learned about. It's called GYANT, and I am here today with Paige Heaphy. Don't get it twisted with that PH. You learned in school that could also be pronounced a different way. So don't forget that, kids. She's the Chief Integration Officer, and we're going to talk about AI today, which is very intriguing and exciting, and I love all things technology. So Paige, welcome to the show.
Thank you, Sharon. It's a pleasure to be here, and welcome to all the Dr. Whisperer podcast listeners.
Yay!
That's a tongue twist.
That is, right? So Paige, why don't you just tell me a little bit about GYANT, and then let's see where this takes us, where this conversation leads us.
Certainly. So GYANT is a company that creates AI tools. They are designed for patients and the everyday person to use. We sell to hospitals, health systems, health plans, insurance companies that then they promote out to their clients, their consumers, their patients to use. We have a AI-based triage product. It's a symptom checker. So essentially it allows an everyday person to be able to check their symptoms. You know, if they feel like they're having a sore throat, they feel like they might have COVID, they can go online and be able to run through an AI-based set of questions that at the end of it offers advice for where they need to seek care. Sometimes all they need to do is self-care. Sometimes they may need to engage with telehealth or urgent care or call their PCP. Sometimes it's more serious where we might need to direct them to the emergency room. But the whole intention of our tools is to be able to give users the autonomy and have that control in their decision-making process around their healthcare decisions, and then to be able to navigate them to the lowest cost of care, right? Healthcare is so increasingly expensive. It's, even at the national level, it is a topic of conversation for how much we spend nationally. It's becoming unaffordable. And so our goal as a company is to be able to offer these tools that make seeking healthcare more accessible, available 24/7 whenever someone needs to use them, and then to be able to direct people or offer advice to, where is the lowest cost of care, so they're not having to spend unnecessary dollars out of their wallet.
Great. So when I think about what your company does, it reminds me a lot of what happens when I go to Bank of America online.
Exactly.
And they asked me if I would like to chat. And I would love nothing more than to chat online sometimes than with a human. Sorry to all my fellow humans out there, but technology seems to be sometimes a much more efficient route, especially when it comes to healthcare. Sometimes it can be very difficult to navigate through even getting to a front office or finding out a location, or is something still open? When I think about directories, even for healthcare, and when you get that list of doctors and, half of the directory, they're dead.
True. Sometimes that is very true.
Or they're out of business, or they've left the practice, or they've left the hospital. So it seems to be very, very now, very, very future.
Yes.
Now.
Yes.
Am I right about that, Paige?
Absolutely. And that's what we are trying to deliver, right? Healthcare has been traditionally behind the curve in adopting consumer-oriented tools and services. We see it much more often in retail, even in banking, like to your point. the virtual assistant or chatbots are on almost every retail website nowadays, asking if they can help you. And so our goal is to be able to break that mold of the old way of doing things in healthcare, and to be able to offer these same self-service tools for patients and consumers. Why shouldn't they be able to go online and very easily ask a virtual assistant, can you find me a provider in my area? Can you find me a provider that's taking new patients, right? We would all love to be able to do that. And they can be far more efficient, take less time than having to sit on a phone line for the next available agent. And again, to your point, it's nothing about the agents, right? They are trying to work so hard to query all these, questions that are coming in, but they're overwhelmed, right? There's just so many people calling, especially in the last 2 years, calling with so many different questions. They just can't handle it. And again, right, the cost of healthcare is increasing. And so hospitals, health systems, health plans, everyone involved somehow, some way in the healthcare system has to be able to find ways to be more efficient, to spend less, and yet deliver the same or better service than in the past.
Right.
So that's where we come in.
So I was watching a fireside chat. That's what I call it, on YouTube.
Yes.
And this healthcare system, I assume one of your clients.
Correct.
And
Tracy Donegan of MLK Community Healthcare. They are actually a safety net hospital in Los Angeles.
Los Angeles, right. Yeah. So I didn't have a chance to watch the whole thing. I wanted to, though, because I was I know that everybody's trying to cut costs, right? And when I think about how do you cut costs? Well, you use anything that says virtual, anything that screams technology. That's where I go. Right. How can we make systems more efficient? So what was their hindrance before they reached out to you? What was happening there, and what problem were you able to solve?
Sure. So MLK Community Healthcare, as I mentioned, is a safety net hospital located in Los Angeles, California. But their pain points are similar. They just take on a different look and feel than what's really happening at all hospitals and health systems, physician offices across the nation, right? We engaged with them at a time, it was the middle of the pandemic. And so they were seeing just, a huge surge in calls to their call center. I think I have COVID. How can I get tested? I know you don't want me coming to the hospital, but where else should I be going? Help. Yeah. And so we started with them putting up an initial screener for COVID. It was an AI-driven COVID screener. And then at the end of the assessment, it offered advice around, doesn't seem like you have the symptoms, so just stay at home, just monitor for another 12, 24 hours. If the symptoms change or worsen, then, call your doctor. Or it seems like you have COVID, here's what you need to do. And over the course of the pandemic, prior to having tests, right, we offered advice around what to do if you have COVID and, where they needed to go. Once they had testing available, then we offered the advice about where to go for testing. When the vaccine became available, we helped offer advice and navigate their consumers and patients as to where to go to get the vaccine. So for them, it really allowed them to redirect many of those inquiries that were coming through the contact center to be able to go online and to be able to get the information that those individuals needed in order to alleviate their fears or seek the right care.
Right. So it's giving an automatic response that is a thought out response with real information that is within the demographic.
Yes.
Right.
Yes.
Because, I like to think of it as if I say I'd send a direct message, DM on Instagram to somebody, and I get an automatic response, I'm like, okay, I know what this is. I know that this is not a human on the other side. And I'm
Right.
hoping that I get information that is specific to what I sent out. A lot of times when you're doing that on a social media platform, you are not getting the right information. So the difference being that this is a well thought out, a planned, you have certain questions. I'm assuming here, right? But
yes, yeah, absolutely. Very planned. Yeah.
Yeah, I'm sure they gave you a list of questions that are asked all the time, and you're able to give the best scenario for them automatically to really be more efficient. At the end of the day, it's really to be more efficient. We interrupt this awesome podcast to share with you about our sponsor, TIE Technology. TIE Technology was founded with the thought that every customer deserves exceptional customer services. So if you know of any company that has a phone system where the auto attendant doesn't really sound good, you press 1 and you think you're going to go to a live person, but you end up with a broken recording, it's probably time that you call TIE Technology. And if you mention this podcast, you will get the first 3 months for free. So make sure you mention the Dr. Whisperer podcast show. Check them out.
Correct. That's part that is definitely part of it. You know, there's multiple things that we are trying to attack. Many pain points we're trying to attack in offering these AI-driven tools, right? One, we want to increase the access to healthcare, right, and to affordable healthcare. Mm-hmm. Second, we want to be able to improve the overall health quality and experience of the individual. Mm-hmm. We want to be able to improve the health and quality and experience of our entire kind of population, whether you want to think of that locally or statewide or nationally. And third, we want to be able to contribute in some way, shape, or form to preventing the burnout that is occurring in healthcare providers, right? There's so many administrative tasks that occur in healthcare that can be easily automated. And we've all experienced it, right? I mean, let's just talk about the infamous clipboard when you go into a waiting room, right? Mm-hmm. There's still paper-based and a lot of like check. And you know,
I have to interrupt and just tell something that just happened. Yeah. I made an appointment to see a dermatologist, and I typically go to people that don't know what I do for a living. So we make the appointment, and she says, "Can you go on the website and fill out the forms?" And of course, I would love to, and then print it out and bring it in.
Right. Why does that still have to happen? Right?
Why is this happening?
Yeah, it shouldn't, right? And so our goal is to automate those things, you know, make it seamless from start to finish, you know, be able to do that intake online, have it delivered electronically, drop into your patient medical record in the electronic health record that your provider is using. And then when you go into the office, they can pull it up and they're not asking you the questions all over again. Now they're actually just verifying, and then they're able to take the time and drill into some of the areas that are popping out to them as being concerns or red flags. And, you know, it's a much more intelligent engagement and a more personalized engagement, as opposed to just having the care provider ask the rote questions over.
The redundancy at this stage is embarrassing.
Yes. It is, and it's unnecessary, and it's frustrating for everyone. I mean, it's frustrating for healthcare providers. It's frustrating for their front office staff. It's frustrating for the patients, right? And so let's start taking the steps to eliminate all of that. And that's where AI, you know, can come in and play a part, right? We can automate so many of those administrative transactions. So the intake form, the scheduling the appointment, the finding the provider, you know, does this provider take my insurance? You know, after the visit, let's follow up and check in. Were you able to get your medications? Are you feeling okay? You know, do you have any concerns? And then, you know, you can continue kind of along that patient journey, you know, whether it's like the next, you know, appointment that's required, or, you're healthy and, you don't need to visit the doctor again.
So so let me understand, are you only working with hospitals? Do you work with private practices? Is it just multi-location type of practice where there's, 95 doctors? Or do you also treat the small biz?
So we predominantly help hospitals, health systems, and health plans at this point in time. At the extension to those hospitals and health systems, is that they have many physicians attached to them in some way, shape, and form in their community. So we, by virtue of being connected to the health system, are able to extend these services out to many providers and therefore their patients because of that relationship.
Mm-hmm. Gotcha. That's great.
Yeah.
So how long has GYANT been in existence now?
So we started the company, not I personally, but the two co-founders started the company in 2016. Mm-hmm. They went live with their first product in 2018. And so it's really been about 4 years since we've really been on the market and starting to roll out a number of different products. So we have products, like I said, that help do the symptom and checking. And then we have a product that does automate the intake process. Mm-hmm. We also have the ability then to do post follow-up care and to check in with patients. Mm-hmm. And then we have a number of different ways in which we connect with telehealth providers and other digital health providers in order to help facilitate the telehealth visit, make that more seamless. An asynchronous visit, typically those that are done by text or by email, we can help facilitate that by collecting information and making it available to those providers. So we essentially are building products that help along the entire patient journey.
And does your product sync with all different electronic health records, all systems?
We do, yes,
yeah,
we do. So we can integrate with different different electronic health records, different provider directories, different CRMs. So we're integrating right and left because that's kind of what you need to be able to do nowadays.
I love it. All right. Well, I have to know something about you, Paige, before I let you.
Okay.
I need to know more about this Lean Six Sigma Black Belt certification. Please. Congratulations, right. Whatever the heck that is. Congratulations.
Thank you. Lean Six Sigma are two methodologies around doing process improvement. Lean comes from the Toyota and is the method they developed over decades around how to continually eliminate waste and improve their processes in the entire Toyota spectrum, not just, started in their manufacturing plants, but then extends all the way through all of their business processes. Six Sigma actually came out of American business, but with the same intention. How do you make business processes more efficient? And so part of my career over the last decade or more has really been around how do you help make hospitals, health systems, physician offices more efficient, safer, deliver better patient experience, deliver better quality of care. And so that's where having that knowledge and expertise comes into play.
So it doesn't actually mean that you can kick my butt.
Sadly, no.
Damn.
Sorry.
No,
sadly, no. And that is not something I would ever want to do. So
I love any certification that comes with black belt.
I know, right?
But it really does paint a picture that you know your stuff. So that's really, really impressive. So is there anything that you want to leave the audience with to understand GYANT a little bit better? Maybe even the mission behind the company itself?
Yeah. Yeah. You know, our mission is to make lives better. That's what we're trying to do at the end of the day. And so if the members of the audience are interested, you can go and check out our virtual assistant. It's available at GYANT.com, and that's GYANT.com. Martin Luther King Community Healthcare, MLK Community Healthcare in Los Angeles has it available, as well as a number of other hospitals and health systems across the US. So yeah, we're very excited for kind of what we're doing as a beginning step around, you know, helping to reduce the cost of care and make a better experience for patients, and, you know, looking forward to the journey and how we're going to grow and offer more in the future.
I mean, let's do that. Let's make healthcare more efficient.
Right.
That would be
right.
amazing. Yeah.
Same. I feel the same way.
Each other. Let's, you know, not have us fill out endless forms. Or lose our prescriptions, or not have the right record. You know, all of it is, we certainly need a lot of help in this industry, and technology is always the answer. So be not afraid, healthcare people listening or watching. Technology is our friend, and this is the future. The future is now, as I always like to say. Let's not wait any longer to be more efficient, because it does affect the patient care at the end of the day. So Paige, we will have all the information of how to learn more about your organization in the show notes. Thank you so much for being here today.
Thank you. It was a pleasure.
I appreciate you. Have a good day.
Likewise. Take care.
So don't forget, if you mention that you've seen the show or listened to it on the podcast, mention Thai Technology and you will get 3 months for free.